Hi, I'm Dr. Stan Davis with North Texas Children's Anesthesia. We created this short video in order to give you some idea of what to expect during your child's visit to the surgical facility, as well as try to address common questions that parents ask about their child's anesthesia. The first thing parents want to know about is our background and training. At North Texas Children's Anesthesia, all of our physicians are board-certified anesthesiologists who have received additional pediatric subspecialty training. This is important to ensure that your child not only receives the safest anesthesia care, but also that care is specifically tailored to your child's developmental and emotional needs. Our anesthesiologists will be with your child the entire time they're in surgery, since our physicians provide one-to-one care for your child from the preoperative suite all the way through the recovery room. In preparation for your child's procedure, one of our physicians will attempt to contact you by phone the night before to give you some basic information and to answer specific questions you may have about your child's anesthesia. In the event that we are unable to reach you by phone, the anesthesiologist will be available to answer your questions during the preoperative visit the day of the procedure. Fasting prior to anesthesia is very important for the safety of your child, so we want to be clear on the essentials. First, no solid food or milk are permitted after midnight. Infants, however, may have formula until 6 hours prior to, and breast milk until 4 hours prior to the time of surgery. Clear liquids, including pulp-free juice, Gatorade, popsicles, and Jell-O without fruit, are permitted until 3 hours prior to the time of surgery for any age child. Your child should take their usual medications on the day of surgery with a sip of water at least 2 hours prior to the time of surgery. Your child should wear comfortable, loose-fitting clothing or even pajamas to the hospital or surgery center. In our experience, kids tend to be more comfortable and less stressed if they're allowed to remain in their own clothing. If this is not feasible because of the procedure your child is having, a hospital gown will be provided. Also, younger children may benefit from wearing a pull-up to the surgery center if they typically wear one at night or are prone to accidents, as these can be more common waking up from anesthesia. As the time of your child's procedure approaches, you'll be moved to the preoperative holding area. In pre-op, a nurse will weigh your child and take baseline vital signs. Your waiting time in this area is normally 30 to 45 minutes, so it's helpful to have something to entertain your child during this time, such as watching DVDs or playing handheld video games. Keeping your child engaged in an activity will greatly help in reducing anxiety during their wait. Many facilities furnish these, so you may want to check before bringing your own. Probably the most frequent question we are asked by parents is, will I be with my child when they fall asleep? Unfortunately, unless your child is having a non-sterile procedure, such as a GI or radiology, parents are generally not allowed into the operating room. Because of this concern, we routinely use pre-medication to ensure a stress-free separation when it's time for your child to go to the OR. The medication we use for this is Versed, which the nurses affectionately call Goofy Juice. It's usually administered as a nasal spray in children 2 years or less, and as an oral liquid in older children. The pre-medication will cause your child to be less anxious and generally disinhibited, hence the name Goofy Juice. Remember, the desired result is a stress-free separation. Only rarely will children fall asleep with this medication. While we're talking about separation, a word about parental attitude is probably in order. Since children take their cues from their parents, an upbeat, positive attitude rather than a tearful goodbye really facilitates a smooth separation as we leave for the operating room. In addition, we encourage your child to take any security or comfort items, such as blankets, stuffed animals, or pacifiers, with them to the OR. Many kids are concerned about getting a shot in the operating room. The good news is, most children will fall asleep by breathing anesthetic gas, since we do our best to avoid a shot in this process. This is accomplished by letting the child breathe through a fruit-scented mask while the nurse attaches the necessary monitors. On average, it takes about 1 minute for children to lose consciousness after they begin breathing the gas. At this point, an IV is usually started to allow the administration of additional anesthetic medications, including pain medication and anti-nausea medicine. In most cases, the IV will remain until your child has gone to the secondary recovery area and the nurse is confident that your child is tolerating oral liquids and does not need additional IV medication. If your child is having urologic or hernia surgery, the anesthesiologist may add a nerve block, called a caudal block, to the general anesthetic. This is done to reduce the amount of narcotic pain medicine needed and to allow your child to be more comfortable during the transition from recovery room to home. If this is an option, your anesthesiologist will discuss the details with you before surgery. In addition, you can find more specific information on our website by looking for the topic titled Caudal Block. Throughout the surgical procedure, the anesthesiologist will closely monitor your child's vital signs, including heart rate, blood pressure, respirations, and oxygen saturation. Additionally, the anesthesia will be adjusted as needed for the length of the surgical procedure. At the completion of the procedure, the anesthesiologist will accompany your child to the recovery room, where they will receive one-to-one care from a recovery room nurse during the initial recovery period. We know that you're anxious to see your child, but please be patient, as they'll be very sleepy initially in recovery and they need the undivided attention of the recovery room nurse. As soon as your child begins to regain consciousness, generally in 10 to 15 minutes, you'll be called to the recovery area to be reunited with your child. Once in the secondary recovery area, you can expect your child to be sleepy and perhaps fussy during their initial time there. Depending on the length of your child's surgery and their need for pain control, you can expect to spend somewhere between 30 minutes to 2 hours in the secondary recovery area. This time is needed to observe your child for more complete recovery from their anesthetic, as well as to administer additional pain medication and anti-nausea medication if needed. Oral intake of clear liquids or popsicles is encouraged, but not always mandatory. While you wait, the nurse will give you discharge instructions, including activity limitations, medications, and things to watch for, as well as follow-up instruction with your child's surgeon. When it's time to leave, the nurse will escort your child to the car. I hope you found this information useful, and remember, there's more specific information available on our website. So on behalf of North Texas Children's Anesthesia, I want to thank you for trusting us with the anesthesia care of your child. We really do consider it a privilege.